So I'm Beth, a physiotherapist who's also a adult gymnast who injured herself during a gymnastics skills about 4 months ago. So today it's the day 4 after my surgery last week. The last 2 days has actually been really difficult because I was in so much pain, and I was really grateful for my family because I basically needed them help for everything. So I needed my mum to wash my hair. I was barely able to move around the house. It takes me much longer to get dressed and much longer to move around. So what's been happening so far and how I'm rehab myself. So in terms of mobility, I use elbow crutches, and to stand, we call it the H method. So you put it in a H like that. You try and bend your knees and you can push up like this to come up and down. So that's how I've been walking around the house. Maybe I'll show you as well. Which, as I sit down, I take it out and lean back. And I've got a bit of space so I can put it to the side of my bed. And for me to swing around, I just unhook my feet, swing it around the bed, and then kind of just shuffle myself up. So you might see these blue stockings, so they are called the TED stockings. These TED stockings are used to prevent a blood clot in my legs, so prevent what we call DVT, because as you're not mobilizing as much and as you go through surgery, your risk of a deep lengthened braces would increase. So for me, my surgery is on my right knee. I've got a 2B grip here, so it's an elastic band to just help protect the dressings that I've got here. So I went through a keyhole surgery, so you can see there's a few plaster here and here as well. So there's a slightly longer bits here because they've also done an extra procedure called the LET to give extra stability in my knee, especially for any twisty movement. As you can see, my knee is still quite swollen. With my range of motion, exercise-wise, I've been practicing pressing my knee down. I am pressing my knee down. You can see there's a bit of micro movement there. The key priority for the first stage of rehab is trying to get the extension. So another thing that I've been trying to do is maybe when I'm on the sofa, just resting, and when in bed, is getting a pillow. As you can see, I really like blue. There's so much blue around this room. So you're going to lift that leg up, and you're going to place it on the pillow. So this will allow extra height for me to try and really extend that knee. So this is an exercise that we try and practice to work on that full extension. Of course, I try to move my ankles a little often as well to make sure the circulation flow there too. So that is the knee pressing down exercise. The other way I can do it is just gently pressing with my hands as well. Another exercise that I've been practicing is trying to stretch my calves out. So I am quite a flexible person, I've always been. But if you're unable to reach your toes, you can use like maybe a bit of a robe, a towel, or a band. Just put it across, and then you can sort of stretch the back of your calves. So I'm going to bring it back out. With my healing, some of you know that I am quite interested in yoga therapy, so I do believe in meditation and mental performances and mindset to help the neuroplasticity and enhance the healing process. So every morning when I wake up, I try and take my medication, and then I'll just do a mindfulness track around healing. So about 10 minutes, 20 minutes or so, to allow my body to calm and heal faster, hopefully, and accepting where I am. This is my medication back from the hospital and a discharge pack. So the main one that I take every day, so I've got the rivaroxaban. So this is a blood thinner that I got prescribed to prevent me to having blood clot. Really important. Pain medications wise, I've got these two. So I've got paracetamol to take regularly, and also codeine as well. So codeine is an opioid, so normally it's prescribed for a short-term use rather than for long-term pain perspective. I didn't realise how the codeine was effective until the codeine effect wears off. So when I take the codeine, I do feel a little bit more tired and drowsy. So I'm not expecting myself to do more than I normally would have done. Yeah, they definitely work, because if I don't take them, I feel the pain, especially when I move. Another thing that's slightly more controversial, it's using like a TENS machine and a muscle stimulator, because I found the first week or two of rehab with my patients as well, it's really hard to get their VMO activated, and you do have a lot of quad wasting, so even my left one's actually getting weaker. But the VMO, it's your vastus medialis muscle, the muscles that runs in your inner thigh. So I bought a TENS machine or a muscle stimulator to, when I'm not doing my exercises, when I'm resting or watching TV, doing my admin, I put this on. So I just put it on for about 10-15 minutes, nothing too long, but it does seem to help me relax a bit, and also I don't feel it as much in terms of the pain. So I put one on here and there. I guess, of course, I would like my progress to be faster, but I need to listen to my body and just try and take it easy. For moments like this, I found journaling really helpful, and also just reaching out to friends and family that you really care about, or they deeply care about you. So yeah, I'm all set. So I just turned the machine on. So there's different modes in this sort of device. So I've got the muscle, the MES mode on. So and then I turn it up until I feel a contraction. If you're new to this, I'll probably say try and play around with the setting first, because it can feel quite intense. So it kind of pulses, and then every now and then I'll get a muscle twitch. Not sure how clear is this video, but you can see my quadriceps here, my VMOs kind of activating. Oh, there you go. I don't know whether this is like a lazy way to exercise, but also maybe a way to just keep the circulations going and helping my muscles to be aware that needs more work. And there we go, there's a contraction. And relax. Yeah, so I set it on for about 10 minutes. So for the next 10 minutes, it will be rolling and tensing my quads. Regarding to icing, I've got a Acro cuff, which is this nice blue thick thing where I can completely wrap around my knee. I ice it for about 20 minutes, pretty much literally as often if I can, because I do find icing is probably one of the most effective way for me to manage my pain, and I can stretch my hamstring extension a lot more when I use the Acro cuff. Oh, there you go, my muscles are twitching now again. It's kind of an interesting sensation. Yeah, so given that it's been day 4, I think it's not been too bad. Everything's going in the right direction. Of course, it's frustratingly slow, but hopefully when I look back to this video, it will remind me of the progress that I've made. And for somebody who's going through a similar journey, just reminding yourself that taking that time, be kind to yourself, and everyone will grow in their own way, in their own speed, and everyone will heal in their own speed. Allowing the healing to happen, and do physio and strengthening exercise on the side. This is so nice. Kind of don't want it to stop. Yeah, just pop it by the side so it's not too far. Oops. This happens a lot where I'm dropping things. And the room's messy, but it will get done when it gets done. So get back out of bed, I shuffle like this. Oh, another good exercise too is also the knee bending as well. But I do think that one's something that I also struggle. But everything's work in progress. I hook my feet underneath, wrap it round, breathe, and shuffle forwards. H technique again, push up. And that's my progress for today.